Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Happy New Year to all the listeners. Thank you for listening in 2024 and hope to see you here weekly in 2025. Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Final, 10-year outcomes with Nivolumab plus Ipilimumab in advanced melanoma. Background. Previous results from this trial showed longer overall survival. After treatment with Nivolumab plus Ipilimumab or with Nivolumab monotherapy than with Ipilimumab monotherapy in patients with advanced melanoma. Given that patients with advanced melanoma are living longer than 7.5 years, longer-term data were needed to address new clinically relevant questions to conclusions. The final trial results showed a continued ongoing survival benefit with Nivolumab plus Ipilimumab and with Nivolumab monotherapy, as compared with Ipilimumab monotherapy, in patients with advanced melanoma. Asundexian versus Apixaban in patients with atrial fibrillation. Background. Stroke prevention with direct-acting oral anticoagulant agents in patients with atrial fibrillation confers a risk of bleeding and limits their use. Asundexian, an activated factor 11 (A.I.O) inhibitor, is an oral anticoagulant that may prevent strokes with less bleeding, say conclusions. Among patients with atrial fibrillation at risk for stroke, treatment with Asundexian at a dose of 50 mg once daily was associated with a higher incidence of stroke or systemic embolism than treatment with Apixaban in the period before the trial was stopped prematurely. There were fewer major bleeding events with Asundexian than with Apixaban during this time. Vutrisiran in patients with Transthyretin Amyloidosis with Cardiomyopathy. Background. Transthyretin Amyloidosis with Cardiomyopathy, ATTR-CM, is a progressive, fatal disease. Vutrisiran, a subcutaneously administered RNA interference therapeutic agent, inhibits the production of hepatic transthyretin C conclusions. Among patients with ATTR-CM, treatment with Vutrisiran led to a lower risk of death from any cause and cardiovascular events than placebo and preserved functional capacity and quality of life. Adjuvant Pembrolizumab versus observation in muscle-invasive urothelial carcinoma. Background. Muscle-invasive urothelial carcinoma is an aggressive disease with high rates of relapse. Whether Pembrolizumab as adjuvant therapy would be effective in patients with high-risk muscle-invasive urothelial carcinoma after radical surgery is unknown to conclusions. Among patients with high-risk muscle-invasive urothelial carcinoma after radical surgery, disease-free survival was significantly longer with adjuvant Pembrolizumab than with observation. Next, we will be discussing articles from Journal of American Medical Association. Transcriptomic profiles in nasal epithelium and asthma endotypes in youth. Questions: can nasal epithelial gene expression be used to identify asthma endotypes in youths aged 6 to 20 years? And which asthma endotypes are most common? Findings: cluster analysis of 8 signature genes in nasal epithelium from 3 studies of predominantly racially and ethnically minoritized youths with asthma revealed 3 mutually exclusive profiles corresponding to T helper 2, T2 high, T helper 17, T17 high, and T2 low/T17 low asthma endotypes, which were identified in similar proportions across the 3 studies, despite differences in racial and ethnic composition and geographic location. T2 high asthma was the least common asthma subtype in all 3 studies, 23% to 29%, meaning in elma, mini, n, Nasal transcriptomic profiles were similar across 3 studies of mostly Puerto Rican and African American youths with asthma and revealed predominantly T2 low asthma endotypes. Next, we will be discussing articles from Annals of Internal Medicine. Implementation of billing for patient portal messages as e-visits in a large integrated health system. Background. Patient-provider communication through the patient portal has markedly increased in recent years. Some healthcare facilities implemented programs to enable providers to bill for responding to patient-initiated messages that require substantive medical decision-making through an e-visit. Conclusion. These findings suggest that implementation of e-visit billing was associated with a modest decrease in patient-initiated portal message volume and was overall acceptable to providers in a large integrated health system. Next, we will be discussing articles from British Medical Journal. Comparative effectiveness and safety of single inhaler triple therapies for chronic obstructive pulmonary disease. Objective to compare the effectiveness and safety of budesonide glycopyrrolate formoterol, a twice-daily metered dose inhaler, and fluticasone umeclidinium vilanterol, a once-daily dry powder inhaler, in patients with chronic obstructive pulmonary disease, COPD, treated in routine clinical practice. Conclusions. Budesonide glycopyrrolate formoterol was not associated with improved clinical outcomes compared with fluticasone umeclidinium vilanterol. Given the added climate impact of metered dose inhalers, health systems seeking to decrease use of these products may consider steps to promote further prescribing of fluticasone umeclidinium vilanterol compared with budesonide glycopyrrolate formoterol in people with COPD. Next, we will be discussing articles from Lancet. Guselkumab in patients with moderately to severely active ulcerative colitis, Quasar, Phase 3 double-blind, randomized, placebo-controlled induction and maintenance studies. Background. Interleukin-23 inhibition is effective in treating ulcerative colitis. Guselkumab is a dual-acting, human Ig-1, interleukin-23 p19 subunit inhibitor that potently neutralizes interleukin-23 and can bind to CD64. We aimed to evaluate the efficacy and safety of guselkumab as induction and maintenance therapy in patients with ulcerative colitis. Interpretation. Guselkumab was effective and safe as induction and maintenance therapy in patients with moderately to severely active ulcerative colitis. Population health impact of new drugs recommended by the National Institute for Health and Care Excellence in England during 2020 A retrospective analysis. Background. Health systems experience difficult trade-offs when paying for new drugs. In England, funding recommendations by the National Institute for Health and Care Excellence, NICE, for new drugs might generate health gains, but inevitably result in foregone health, as the funds cannot be used for alternative treatments and services. We aimed to evaluate the population health impact of NICE recommendations for new drugs during 2022 interpretation. During 2020, NHS coverage of new drugs displaced more population health than it generated. Our results highlight the inherent trade-offs between individuals who directly benefit from new drugs and those who forego health due to the reallocation of resources towards new drugs. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Hepatology. Metabolic phenotyping of patients with advanced chronic liver disease for better characterization of cirrhosis regression. We demonstrate that fibrosis regression of cACLD is shaped by a multifaceted interplay of clinical, genetic, and metabolic factors, obesity, high LSM, and carrying the RS1260326 variant of GCKR, were associated with a lower probability of fibrosis regression. Metabolomics revealed lipid perturbations associated with fibrosis regression, with taurocolic and taurocanodeoxycholic acid emerging as key predictors. We identified a lipid signature associated with regression of ACLD that could be used as a non-invasive biomarker. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Mucosal single-cell profiling of Crohn's-like disease of the pouch reveals unique pathogenesis and therapeutic targets. Background and context. Crohn's-like disease of the pouch is a challenging complication after restorative proctocolectomy with ileal pouch anal anastomosis to treat ulcerative colitis. The pathophysiology of this chronic condition remains unknown to date. New findings. Single-cell analysis of mucosal cells from pouch body and pre-pouch ileum was used to identify pro-inflammatory cell populations and elevated endoplasmic reticulum stress in Crohn's-like disease of the pouch. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Clinical characterization and outcomes of human clade IIB mpox virus disease. Background. The global mpox outbreak, which started in May 2022, was caused by a novel clade IIB variant of the mpox virus, MPXV. It differed from the traditional Western and Central Africa disease in transmission patterns and clinical presentation. Notes. Conclusion. Mosaic provides comprehensive insights into the clinical and virologic characteristics of mpox caused by the clade IIB variant. The study forms the basis of clinical characterization for ongoing mpox outbreaks. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Multiplex assays of variant effect and automated patch clamping improve KCNH2 LQTS variant classification and cardiac event risk stratification. Background. Long QT syndrome is a lethal arrhythmia syndrome, frequently caused by rare loss of function variants in the potassium channel encoded by KCNH2. Variant classification is difficult, often because of lack of functional data. Moreover, variant-based risk stratification is also complicated by heterogeneous clinical data and incomplete penetrance. Here we sought to test whether variant-specific information, primarily from high-throughput functional assays, could improve both classification and cardiac event risk stratification in a large, harmonized cohort of KCNH2 missense variant heterozygotes. Conclusions. High-throughput KCNH2 variant MAVE data meaningfully contribute to variant classification at scale, whereas long QT syndrome penetrance estimates and automated patch clamping peak-tail current measurements meaningfully contribute to risk stratification of cardiac events in patients with heterozygous KCNH2 missense variants. Here are the articles from Journals of the American College of Cardiology. Using electrocardiogram to assess diastolic function and prognosis in mitral regurgitation. Background. The determination of left ventricular diastolic function, LVDF, in patients with significant, greater than or equal to moderate, mitral regurgitation, MR, poses a complex challenge. We recently validated an artificial intelligence-enabled electrocardiogram, A.I.ECG, algorithm to estimate LVDF objectives. This study sought to evaluate the risk of all-cause mortality across A.I.ECG LVDF-derived myocardial disease, MD, grades in MR. Results. Of 4,019 patients with significant MR, mean age 69.8 years, 49.0% women, 1,175, 29.2%, 1,881, 46.8%, and 963, 24.0%, were classified by A.I.ECG as MD1, MD2, and MD3, respectively. The median mitral effective regurgitant orifice area was 26 square millimeters, Q1 Q3, 20 to 36 square millimeters. Over a median follow-up of 3.5 years, 1,636, 40.7%, patients died. In multivariable survival analysis adjusted for multiple risk factors, a higher diastolic function grade was independently associated with an increased death risk, MD2. Adjusted HR, R, 1.99, 95% C, 1.62 to 2.45, MD3, R, 2.65, 95% C, 2.11 to 3.34. These findings were consistent when accounting for mitral valve intervention and across various sensitivity and subgroup analyses conclusions. In patients with significant MR, the grading of LVDF by AI-ECG is independently associated with all-cause mortality. From JAMA Cardiology, Artificial Intelligence Enhanced Electrocardiography for Prediction of Incident Hypertension. Question: can an electrocardiography, ECG-based artificial intelligence risk estimator for hypertension, AIR-HTN, predict incident hypertension and stratify risk for incident hypertension-associated adverse events? Findings: in this prognostic study, including an ECG algorithm trained on 189,539 patients at Beth Israel Deaconess Medical Center and externally validated on 65,610 patients from UK Biobank, AIR-HTN predicted incident hypertension and stratified risk for cardiovascular death, heart failure, myocardial infarction, ischemic stroke, and chronic kidney disease. Meaning results suggest that AIR-HTN can predict the development of hypertension and may identify at-risk patients for enhanced surveillance. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Regional adiposity and insulin sensitivity. Interactions with menopause and HIV in middle-aged Black African women. Objective: to explore depot-specific functional aspects of adipose tissue, examining the putative role for menopause and HIV status on insulin sensitivity, SI, and beta cell function in Black South African women. Conclusion: insulin sensitivity and beta cell function were distinctively associated with ASAT and GIASAT. While menopause did not influence these relationships, HIV had a significant effect on adipose tissue, characterized by variations in cell size distribution and transcript levels within the depots. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Patient-relevant digital motor outcomes for clinical trials in hereditary spastic paraplegia type 7, a multi-center prospects study. Background and objectives. With targeted treatment trials on the horizon, identification of sensitive and valid outcome measures becomes a priority for greater than 100 spastic ataxias, while digital motor measures assessed using wearable sensors are considered prime outcome candidates for spastic ataxias. Genotype-specific validation studies are lacking. We here aimed to identify candidate digital motor outcomes for spastic paraplegia type 7, SPG7-1 of the most common spastic ataxias that 1. reflect patient-relevant health aspects, even in mild, trial-relevant disease stages, 2. are suitable for a multi-center setting, and 3. assess mobility also during uninstructed walking simulating real life. Discussion. We here identified trial-ready digital motor candidate outcomes for the spastic ataxia SPG7 with proven multi-center applicability, ability to discriminate patients from controls, and correlation with measures of patient-relevant health aspects, even in mild disease stages. If validated longitudinally, these sensor outcomes might inform future natural history and treatment trials in SPG7 and other spastic ataxias. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest Exacerbation History and Risk of Myocardial Infarction and Pulmonary Embolism in COPD. Abstract background. Acute exacerbations, AEs, of COPD, are increasingly recognized as episodes of heightened risk of cardiovascular events. It is not interpretation. The risk of MI and PE increased with the frequency and severity of AEs of COPD in this large, real-life cohort of patients with COPD. Differential association of COPD subtypes with cardiovascular events and COPD exacerbations. Background. The coronary artery calcium score, CACS, and ratio of the pulmonary artery to aorta diameters, PA, a ratio, measured from chest CT scans, have been established as predictors of cardiovascular events and COPD exacerbations, respectively. However, little is known about the reciprocal relationship between these predictors and outcomes. Furthermore, the prognostic implications of COPD subtypes on clinical outcomes remain insufficiently characterized. Research question: how can these two chest CT scan-derived parameters predict subsequent cardiovascular events and COPD exacerbations in different COPD subtypes? Interpretation: two chest CT scan parameters, CAX and PA, a ratio, hold distinct predictive values for cardiovascular events and COPD exacerbations that are influenced by specific COPD subtypes. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Pyrazinamide safety, efficacy, and dosing for treating drug-susceptible pulmonary tuberculosis, a Phase 3, randomized controlled clinical trial. Rationale: optimizing pyrazinamide dosing is critical to improve treatment efficacy while minimizing toxicity during tuberculosis treatment. Study 31/AIDS Clinical Trials Group A5349 represents the largest Phase 3 randomized controlled therapeutic trial to date for such an investigation. Objectives: we sought to report pyrazinamide pharmacokinetic parameters, risk factors for lower pyrazinamide exposure, and relationships between pyrazinamide exposure and efficacy and safety outcomes. We aimed to determine pyrazinamide dosing strategies that optimize risks and benefits. Conclusions: flat dosing of pyrazinamide at 1000 mg/d would be readily implementable and could optimize treatment outcomes in drug-susceptible tuberculosis. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Benefits and harms of coronary revascularization in non-dialysis-dependent chronic kidney disease and ischemic heart disease, a systematic review and meta-analysis. In people with non-dialysis-dependent CKD, revascularization may lower all-cause mortality and risk of cardiovascular events. Adverse kidney events, which are often cited as a reason to avoid revascularization, were uncommon. Additional research on the effect of revascularization on patient-reported outcomes in people with non-dialysis-dependent CKD is needed. Here are the articles from Kidney International Reports. Projecting the population-level burden of CKD progression according to urine albumin to creatinine ratio categories. Introduction. Urinary albumin to creatinine ratio, Walker, is an independent predictor of chronic kidney disease, CKD, progression. However, there is limited evidence on the burden of CKD according to Walker categories at the population level. This study estimates future clinical and financial burden of CKD according to Walker categories using the Inside CKD microsimulation. Conclusion. This study highlights the disproportionate population-level clinical and economic burden associated with individuals within KDIGO-Walker categories A1 and A2, who represent most of the CKD population. This awareness will help healthcare decision-makers to appropriately allocate resources and interventions to the CKD population, including those with mild to moderately increased albuminuria, to reduce clinical and economic burden associated with CKD.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.